cancers in the long
So,
run.
no, not cancer treatment, but yes, patients who are on chemotherapy, for example. And we're not talking about head and neck cancer. We are just talking about general cancers.
Right.
And prior to start of treatment, it's best to have a checkup, right? And the problem with chemotherapy is all the side effects that it creates. There are a number of side effects. Your salivary glands is affected, so you have reduced salivary flow, and that makes you then very high risk to gum disease and to decay in the mouth. Also, your taste is altered.
Right.
Your immune responses are slow. You are more susceptible to ulcers in the mouth. And again, invasive treatment like extraction carries a risk, because when you are on chemotherapy, two things happen. Your your neutrophil count is low and your platelet count is low.
Exactly.
With the low platelet count, you will encounter bleeding problems after an extraction. So if you have to plan an extraction, it's not an impossible feat, but it's better to have all your platelet count 48 hours prior to the extraction.
Right. Right.
I would suggest that if you are going to have an extraction, usually chemotherapy, there are breaks in the treatment, and you have to take advantage of the break time and have the treatment during that time. How much of SLS is important in India, but it tends to reduce ulceration in the mouth.
During the chemo?
During the chemo, yes. And
sorry, can you say that again?
So toothpaste
We'll just make
containing,
sure that we'll put it in our notes as well.
yeah, so toothpaste containing sodium lauryl sulfate, or SLS as it's said.
SLS, okay.
Yeah, and they do have an increased tendency to cause more ulceration in the mouth. So many patients prefer to have SLS free, but Sensodyne do SLS free toothpaste as well.
Okay.
And they're pretty good, yeah.